We have an excellent, what Tom has pointed out for all of us, and it should be obvious, our good friend Tazeen has a new baby, and she is sharing our time with her child generously at this late hour. Also, for everybody, we will be taking questions in the Q&A section for the Zoom, so please go ahead and add questions. We'll take them and answer them at the end. We have our next speaker is from the Gambia, and we have the pleasure of Ebrima Nyasi discussing about developing oxygen treatment centers. So we turn the floor over to you and welcome.
So Ebrima, can you unmute and turn on your video? Thank you.
The video's fine. There we go.
Oh, can you hear me now?
Yes, go right ahead.
Thank you very much. These slides were based on a talk I given some time ago last year on the EWB, on the EBC. It's about sustainability of oxygen concentrators. Good. Actually, there has been a study, a retrospective study that we conducted in Gambia when I was working at the Medical Research Council, where we found out that oxygen concentrators can actually operate efficiently for 6 years or more in our settings, low resource settings, with basic maintenance skills that could easily be taught. This was actually a study that we did. It's an analysis that we have already conducted after 7 years of maintenance on concentrators. And this was based on our database, biomedical engineering equipment database. And we found this interesting results, which we wanted to share with everyone. So the summary of the findings, we have some of the findings on this slide, where we had, over the period of 7 years, we had 53 problems over 27 concentrators. So we found out that almost 95% of the repairs were actually problems were repaired within 1 day, which was a very good indicator. And the downtime was about 70%, so which was good. And we did also cost analysis of the concentrators, and also a summary of the cost analysis of the concentrators that we did of the services that we have already performed. Go to next slide, please. Hello, can you go to next slide? Okay. The other findings that we have done was this skills mapping. We found out that with simple skills, with just our technicians had a background of electrical electronics technologies, and with training, with in-house cross training and service manuals, they were able to perform amazing jobs, which is a very interesting finding. And this is just enough to be able to perform most of the problems on concentrators. And this is a message for other facilities in the rural settings, where in the facilities where we have people with little background in electronics can be able to perform amazing jobs in servicing of concentrators. So these are findings that we have already discovered on the system. So how was this positive outcome for concentrators achieved? We had a health technology management program where our team had the capability, were given the capability, provided capability to be able to do procurement of concentrators, and advise on the specification of concentrators, provided with an inventory where we're able to record all our all our repairs, which is very important. Every concentrator has undergone, and we have recorded every repair, every attempt to repair in each concentrator. We have recorded all those records on each concentrator over a period of 7 years. And we also have tools and spare parts. So we perform installations, preventive maintenance, and corrective maintenance. Okay, there are practical tips that we wanted to share with the rest of the team. And this includes login and tracking of devices. Okay, that which is actually a database, which is very important. It is a very important tool for any biomedical engineering device. It could be as simple as Excel, but for any technicians or any health facility, if you want to start servicing any equipment, you need to have a database to be able to manage your equipment effectively. And it could be even Excel-based database. It could be any small facility, anywhere. Just get a database where you're able to log all your problems. It's very, very important. The other issue is that we want to advise other people that is to empower the users to be able to perform just in-house basic care for the concentrators. I know nurses in hospitals are too busy, but if they are empowered to be able to perform some basic user care, it makes a lot. Improves a lot on the concentrators, like cleaning the filters regularly, weekly, cleaning the disinfection. This helps a lot on the performance of the concentrator. And it can also be difficult to enforce them, but if you involve the administrators, hospital administrators, to be able to undertake some sort of responsibility, we have to help that as well. Okay. Establishing PM systems, preventive maintenance systems regularly is also important. We used to perform those every 6 months as well. Okay, it's very, very important. And then get some spare parts, a minimum spare parts in-house is very important. And also the model of spare parts cannot be overemphasized, because during the procurement process, then we get the manufacturer's backup. Manufacturers' backup support is very, very important in anywhere. I know this is a problem in the government hospitals, where a patient is just really exposed with a machine and he doesn't know where the machine comes from, where the concentrator comes from. He doesn't have his spares, he doesn't know where to get the parts. It's a problem, But it's important for administrators in government hospitals to involve technicians or where in the procurement, or if they're involved, let them be given the information on where the manufacturers, who are the manufacturer responsibles, where they can get backup support for the manufacturers. It's very important. So they can able to get service manuals or any troubleshooting scripts. It's very important as well. So, and also the proper care of the concentrators in terms of storage. Too often we find concentrators left outside in the open dust environment. The only time someone wants to use structure concentrator is when there's a need for a patient. Apart from that, they just throw it outside without taking care of it, which is not has to be encouraged as well. So yes, spare parts are important about. Yes, the last 2 points is that I just want to inform everyone that we are the prize winner just recently. So we established a social enterprise initiative called Oxymet Global. It's a distribution model we established to scale up access to medical oxygen in several countries in sub-Saharan Africa. So we we're entrepreneurs, so we have to use all those skills to be able to scale up access to oxygen to thousands of people, patients across the sub-Saharan Africa. So our scale-up plan is to support about 3,000 concentrators over the next 5 years, with a projection impact about 50,000 patients. So our pilot project will begin in about 20 hospitals in July this year. So basically, our model is to recruit, provide technical training for biomedical engineers and provide them with the necessary tools and resources to carry out the commissioning, repairs, and preventive maintenance on oxygen concentrators. So among the key activities that we'll be doing is to train the nurses to enhance them with proper usage and productivity, implement implement a database. You have to procure a very good database for biomedical, where we record all our, we used to manage all our repairs and standard interventions, and a minimum stock of spare parts to be kept for supporting immediate need. So engage, one of the most important things also, to engage with the health facilities management in pre-focused advice and replacement plans for oxygen machine, for oxygen concentrators, which is very important. So I think that's all what I have today.
Thank you so much, and for the clear presentation on how clinical engineers are supporting technologies in the Gambia, and also for the material you have shared in publications. For those who have not looked in the chat, there is a link to publications that you can download.